Well, good evening, everybody. It's Dr. Murray from Murray Natural Integrated Health here in Hastings, Nebraska. And we're getting started here again for another live stream. Got a lot of good information for you here today about metabolism and hormone, the metabolism and hormone tip most never discover. And so this is a kind of important topic because, there's some tips that you can utilize when you are trying out some type of different health perspective, ones that will kind of help you get through a health change. Sometimes you've got like 50 or 60 different things that people throw at you and say, hey, try this and try this and try this. Well, this particular tip, which we're going to discuss, really is something that almost everybody can implement part of it. Before we get started, let's go ahead and kind of get through just some general information today. Again, it's Dr. Murray from Murray Natural Integrated Health here in Hastings, Nebraska. And we do a lot of presentations to the community, and also I teach continuing education classes to medical doctors, to doctors of osteopathy, as well as nurse practitioners. I'm a certified medical examiner as well as a naturopathic physician. And so we have about as close as you can get to a conservative primary care type office. We do a lot of lab work, nutrition care. We do EKGs and spirometry. And we certainly refer out to other medical providers when needed. Hyperbaric therapies. There's lots of different therapies and services that we provide here. But getting back to our point on the tip, on the hormone metabolism tip that most never discover, it's important for us to realize that in our country here, we have some huge deficits. The United States, we lead the world in numerous types of diseases, chronic degenerative diseases. We have a really cool crisis management system here. We really do. It is almost phenomenal and miraculous seeming when you can actually do a surgery on a baby in the womb. That's amazing. But when it comes to chronic degenerative conditions, we are not doing the greatest. We rank number 39th in the world in terms of health, despite the fact that we spend more on healthcare than any other nation in the world by far. Infant mortality, we're up in the teens, around 17, compared to other industrialized nations. Incredible. I mean, it's crazy how the lack of health that we have, the lack of healthcare we have in this country, despite having all the money that we have in this country. Around 60% of the country is overweight and obese. And if you look at other the conditions, the chronic degenerative conditions, and all these really screwy conditions out there, such as Alzheimer's, also cancer and autism, MS, a variety of different chronic degenerative conditions, it seems like we just have an epidemic of just lack of health in this country. And then if you look at iatrogenic injuries, and these are injuries that are caused by medications, by medical services, conservative estimates, and this is according to the Journal of the American Medical Association. These are conservative estimates that are confirmed almost every year. Around 100,000 people die each year or more from the proper use of medications from iatrogenic injuries. If you looked at one class of medication, just one, the nonsteroidal anti-inflammatories, there are around, and this is according to the New England Journal of Medicine, they say that around 16,000 people die each year from the use of NSAIDs. We're talking like ibuprofen, right? So there's a lot of medications themselves, or our way of treating here in this country. Wow, they are causing lots of problems as well, at least to say that. Some people need medications, of course. But look at this. So you even have different publications like this come out talking about the problem we have in our society here in our country. Portion sizes have grown. If you look at the size of beverages and you look at the size of food servings over a period of time, they've all grown. And when you look at how much soda is being consumed in our country, you have this reality that young people who normally would not get type 2 diabetes are now getting it all the time. Again, this is from JAMA, and they note here that in their studies that there's been the relative increase in diabetes among children and adolescents from 2001 to 2017, not just with type 2 diabetes, with insulin resistance, but also with just the actual creation of insulin, type 1 diabetes, both of those have increased substantially over the years in our country here. And so that's what you have to basically come up and say, is that modern medicine has reached its pinnacle of success. Almost everyone is sick. And isn't that a spooky kind of concept, a spooky kind of thing to say? It's just a reality, is that our country, we need a health revolution. Everyone seems to be sick. And it's especially in this country because we rank number 37th in the world, 39th in the world in terms of health compared to all these other countries. And we spend all this money, and then our infant mortality risk is up to around 17%, or ranked number 17th in the world in terms of infant mortality, despite we spent all this money. Everybody's sick. It's just crazy. It's crazy. But today isn't talking much about the problems with our healthcare system. It's talking a little bit about this tip, the hormone and metabolism tip that most never discover. You see, we can't blame your doctor. You can't blame your doctor for you or me putting ice cream in our mouth. Can't do that. You can't blame the hospital or the facility that you go to have healthcare services for you not putting vegetables in your mouth. You cannot also blame the insurance company. Everyone's bashing the insurance company or Medicare and all these different. You can't bash them for you and I not doing the exercise and things we need to do. You and I have a responsibility. And yes, we can also look at the problems in our healthcare system, because there are many of them. And I've already mentioned a bunch of them here right now. But you and I have the ability. We have an ability to make a definitive difference in our lives. And through this one health tip, which I'm sure some of you will relate to some of this, but we can have a definitive influence in our health. And that is this hormone and metabolism tip that most won't discover is fasting. Now don't shut off the camera here quite yet, but fasting isn't necessarily just not eating. There's different types of fasting. So we're going to talk about different types here today. Avoiding certain foods or beverages, that's a type of fasting. And then fasting also times during different times of the day can also be of great value. Because remember this, when you start talking fasting and everybody's eyes start to gloss over a little bit, everybody fasts. I've had 2 people in my office this week when I started telling them about fasting, and they said, I don't think I can do that. I mean, I'm a 3 squares a meal kind of person. I have to do that. And I'm sorry, that just doesn't quite make sense. Because when you're talking about intermittent fasting, you're going to talk about starving at all. But so let's talk about some of those issues here right now. Certain foods that you may wish to fast. And I've got 3 case examples here, which are really cool, really interesting. So pay attention to them here. But certain foods. Hello there, Promised Land Pets. Thanks for mentioning me there. You're the best, Doc. Well, thank you so much. Thank you. You're too kind. So you can eliminate, of course, the no-brainer things that we should be eliminating: soda, alcohol, smoking, processed sugar. Those types of things we know are not good for our bodies. A concept that I taught my children when they were growing up is that in a body by God, we should try to be eating foods made by God and not made by man, and eaten in their most natural state. Most people can kind of figure that out. They understand that's an easy concept to understand, because if you put into your vehicle, your body, unleaded gasoline when it's designed for diesel, it isn't going to function right. And the same thing here. If all you're eating is processed and refined foods, if all you're eating is you're putting in soda, and all you're eating is you're eating these things that aren't designed for your body, why would it produce? Why would it function the way it's supposed to? 1/3 of your body is made of food. 2/3 of it is made of water. Doesn't it make sense that we should be trying to put things in here that's made for it? So fasting those certain no-brainer things, those things that, again, are not made by God, but are made by man, that makes sense anyways, which my first case example is going to come to that here in just a second. But it is an important point to make, and this is a tough thing. And please don't think that I'm being too judgmental here. But I had a patient came in and they're a brittle diabetic. And so they were consuming lots of coffee, and they had creamer in it and things like that too. And that's, there's a difference when you start adding in all these things on the foo-foo coffees. You know who I'm talking about out there. But in this case there, I told them they're brittle diabetic. I told them I thought they needed to remove and eliminate their coffee for a period of time and see what it did for their blood sugar numbers. They're brittle diabetic. Boy, oh boy, they did not like that. I said, you're telling me I can't have my coffee? To some people, their food, their beverage, their smoking, their soda, their alcohol, their whatever is their God, kind of. They are unwilling to give that up, even though all common sense says it makes sense to eliminate that. A Dorito is not food. Remember that. Processed foods like that are not foods. So fasting those items and stay away from those items, that makes sense. And so let's start up with our first case study here. If I can get that back on here, I think I'll get that up. Which this individual here was a DOT driver. This was a truck driver, and the truck driver came in, and we did as we always do with the truck driver, because that's what we need to do, is a urinalysis. And on the urinalysis, we saw that they had sugar in their urine, or glycosuria. So we did a finger stick test, and we saw that their blood sugar was high. At this point, I need to find out if they're diabetic. So we did some other lab work with them, and we found out, sure enough, they are diabetic. You can see that their glucose is high there at 137. And we can also see that their A1C is high to 7.6. So 5.7 to 6.4 is a pre-diabetic range. This person is diabetic. They didn't know it. They didn't know it. Now they're overweight. Their blood pressure, it's a little bit pre-hypertensive, and their vision also is 20/40. Now this individual, their insulin was high as well. Now this individual did not want to change their life. This is a truck driver, and truck drivers, they are in a difficult situation. They don't have a whole lot of time. They don't want to pack their foods and all these kind of things. And so I said, well, what are you eating and drinking all the time? They told me about some of the fast food they were consuming, but they're drinking soda every single day. That's the only beverage they were having all day long. And I said, well, listen, you're either going to have to start taking some medication, or you're going to have to start making some changes. And they said, well, okay, I am willing to totally give up soda. Willing to give it up. That's the only thing I'm going to do, because I can't when I'm about. That's all I can do. So they're willing to give up soda, and they drank water and water alone. They did take vitamin D. The only two things they did here is they stopped drinking soda, and they started drinking water, and they started taking vitamin D. Those are the only things we did pre and post here. And you can see dramatic differences between their pre and post blood testing, where they brought themselves out of diabetic ranges just by doing that one thing. And they also noticed that their heel pain and some other symptoms they were having went away just from that. Just from fasting. They fasted soda, right? That's all they did. Some huge dramatic improvements here. Again, and this is only in 1 month. In 1 month, their A1C came down into a non-diabetic range. Their blood sugar came down into non-diabetic ranges. You can see also that their weight came down a significant amount. You can see it originally is 214. This is 1 month, came down. So it came down 10 pounds. And look at this also, their vision was 20/40 to begin with. And now it's 20/25. You know what happened here is that you remove the sugar out of your body in this case, the high fructose corn syrup and all those inflammatory kind of crap that you take in through soda. And the sugar in there can change the osmolarity properties within the eyes. And a lot of diabetics can tell you when their blood sugar is high, they start seeing a little bit differently. And that's exactly what's happening here. And that's the reality, is this individual. You can have people who can basically force their bodies into diabetic ranges by drinking sweetened beverages. Even those who are slender, the studies are showing this, right? British Medical Journal, many others showing if you're consuming soda on a regular basis, watch out. You might be turning yourself into a type 2 diabetic by continuing to drink soda on a regular basis. That if you drink one soda a day, that usually equates into about 7 pounds of weight gain throughout the year. And according to studies, the British Medical Journal just showed you here, is that can predispose you towards developing type 2 diabetes just from consuming that one type of food. So in the truck driver's case here, he fasted and fasted what? He didn't even do any kind of a long fast or intermittent fast. He fasted one thing. He fasted soda. What's something you can do today to eliminate from your diet that you know isn't very good for you? It certainly isn't good for a body made by God, right? You want to be eating things that are made for your body. What's something you can find there today? Okay, so let's go on to our next point, which is referring to, oh yes, okay. So different types of fasting. When we talk about intermittent fasting, that's something else to discuss because everybody fasts, correct? So I'd say most people who eat unhealthily are eating probably in a 16-hour window. They're fasting for 8 when they sleep, right? So you sleep for maybe 8 hours, give or take, and then you eat during the other 16 hours. That is probably not healthy for about anybody. Eating that for that duration of the day, eating into the evening, they wake up in the morning, they eat something for breakfast, then they eat something for noon, and they eat something maybe for supper around 6 o'clock, and then they're eating into the evening, and then they go to bed, and they sleep for 8 hours. They fast for 8 hours. That is not a very healthy diet. It's not a healthy way. Shouldn't be doing that all the time for sure. So intermittent fasting, which means a lot of different things to a lot of different people, what I usually tell patients to do is to extend their fast. Yes, you can do some very extensive fasts, days on end, and I understand that. But you have to be a little careful with patients because you certainly don't want to slow down a person's metabolism and fast too much. So I'll have a little bit of tips on that here in just a minute. So there are 12 and 12 fasts where you're fasting for 12 hours and eating during a 12-hour window. There's also 16 and 8 hour, so that you're actually not eating in an 8-hour period of time, but you're eating in an 8-hour period of time, but you're fasting the other hours. Usually what I tell patients to do is to try to eat in that 6-hour period of time and fast for the other 16. Some people, they'll often do like they'll call the warrior diet, where they're actually eating during a 4-hour window and fasting for the rest. Regardless, if you have weight issues, if you have metabolism issues, if you have blood sugar issues, hormone, any of those things, some type of fasting may be of value for you. You should talk to your provider about this. But when you're doing intermittent fasting the way I'm talking about, which is just extending your fast by a few hours, that is a pretty safe way of fasting. It isn't starving your body. You're already fasting for 8 hours anyways. And so just extending that by around 4 hours or so is probably is safe for most individuals. Again, you should talk to your providers about this. But when's the best time to fast? Let's just say that you are a chocolate cake zealot. It's a part of your religion that you're telling yourself, I have to eat chocolate cake every day of the week. If that's you, it would be a safer time for you to consume that probably in the morning, around 8 o'clock in the morning, as opposed to eating that 8 o'clock at night. Let's say you eat your big meal. You sit down and you're eating that about 6, 7 o'clock at night. Big meal, it's got carbs and fats, all kinds of things in it. So your sugar levels come up, your insulin levels come up. After your insulin levels come up, your insulin goes to all your muscles and say, hey, muscles, I've got something right here for you. I've got sugar right ready for you, muscles. So who wants it? Your muscles sit back. Since in the evening times, you're more sedentary, your muscles say, I don't need it. And so then what happens? Well, insulin then drives those metabolic resources right into fat, drives it right into fat because your muscles don't need it. And your insulin status stays up higher, which does affect your metabolism other ways, affects your hormones. It causes estrogen levels to start to rise. The American Diabetic Association, they acknowledge that high sugar diets and insulin responses have an effect on sex hormone function. So it's an important issue as to when we fast. If you are not going to do what we call intermittent fasting and going to extend your fast, I would strongly recommend that you do not eat and snack into the evening. You should be, after that 6 o'clock time window, at the very least, you should not be consuming at 7, 8, 9, 10 o'clock, 11 o'clock at night. Got lots of patients who are eating at 9, 10, 11 o'clock at night, going to bed and waking up in the morning and having a breakfast again and completing the whole cycle. That is not good on a person's body to have all those carbs, all those fats being processed throughout the night when you don't even need them. So extending your fast is often a good thing here. Here's a patient who came in with, they were tired, they're kind of wiped out. Their wife sent them in because they felt they had sleep apnea. They had a very large neck circumference, a pretty strong individual, had a lot of reflux, sore feet, and breathing difficulty, kind of going up and down stairs. They're winded. So we did a sleep study, and they did not have true sleep apnea. They did have, as you can see on this sleep apnea test, you can see their total hypopnea score is a 10.8, that HI to RDI score. But look at that analysis on the total apneas or lack of breathing events. You see it says central apneas 5. Central apneas or lack of breathing events come from the brain. That's one type of apnea. And then you have obstructive apneas that actually come from the throat, come from obstruction of the air coming down. Two different types of things. So a few central apneas, that's kind of interesting, but this is not really this is a mild sleep apnea. So it's not a very severe amount. Oxygen levels were at 92 there. So there's something, but it's not severe. So we did actually a lung function test. Lung function was fine. So he doesn't have any kind of lung function, decreased lung function here. That's all normal. We look here at the blood test. This is important. Let's come down and look. So we see that this individual, they have their liver enzymes. Yeah, their liver enzyme ALT is at an 81, and their GGT, which is another liver and pancreatic enzyme, is elevated 121. And when I saw that, and their cholesterols and some of those things are high too, but when I saw the GGT high and the ALT high, that's when I went to this individual. I said, okay, how much alcohol are you consuming? And they said, well, 3 beers a night. Every night? Pretty much. And the weekends, maybe 4 or 5 or 6? Maybe. That's where some of the apnea was coming from. The central apnea, the alcohol was slowing down the respiratory centers, was affecting this individual's sleep. So what do you think I asked them to do? I told them to eliminate alcohol, also had them do intermittent fasting. So they eliminated their breakfast meal in this case. And they also eliminate glutens, 3 things. So they eliminated a food, their glutens, because we actually did a food sensitivity test with this individual. And so we did a food sensitivity test. We also had them eliminate alcohol and had them do some intermittent fasting and had them do that for a very short period of time. We're going to show you. And of course, what happened is all their liver enzymes came back to normal. Boom. Great. Awesome. Their also the pain in their feet went away just by eliminating those few things. They lost a little bit of weight as well, just dramatic changes in how they felt, and also their liver function within a very short period of time by fasting or removing some intermittent fasting, and then also eliminating all alcohol as well as gluten for just a short period of time. They did a wonderful, wonderful job. And so if we see this 2.5 weeks later, we see that their cholesterol levels changed dramatically compared to last time. And they were originally at, let's see, their triglycerides are at 337, their triglycerides. Whoops, sorry. Now they're 164. So they, cut that in more than half. Their total cholesterol was boy, I'm going too fast through these. Total cholesterol was at 238. And of course that came down to 162, 2.5 weeks here. That's it. And their GGT, that liver pancreas marker, came down to 60. Cut that in half. It's in the clinically normal ranges. their sleep, their energy, all these things, the abdominal discomfort, their GERD, their plantar pain, the pain in the bottom of their feet, almost completely gone, lost 5 pounds, and their testosterone went up 100 points. I have not seen a patient yet, a gentleman, I'm talking about a gentleman here, who has not seen, if they've had testosterone issues, almost always the estrogen's high, when they make some dietary and lifestyle changes like this and we start working with them, I have not seen time when their testosterone levels do not elevate around 100 points without any kind of testosterone therapy whatsoever. Giving the body what it needs, taking away what it doesn't need, so the body's better able to heal, repair, and self-regulate. Super, super cool. Not to test is to guess, to test is to know. The only way we would know, what a lot of these problems are, I mean, it's like a no-duh, right? The no-duh stuff, you can tell people that it doesn't take an Einstein to figure out, well, if you're drinking alcohol every single night, you're not going to sleep the best every single night, right? That doesn't take a whole lot. So you'd like to give the body what it needs, take away what it doesn't need, so the body can heal, repair, and self-regulate. The last bit on fasting, and I'm going to give you one more case study, which is actually me in just a moment, but our fasting concerns. Fasting for some people can also be detrimental and dangerous. So you do have to be more cautious. People that have a brittle health, sometimes that's not a good thing to reduce or restrict any caloric intake. If you've got extreme cardiac problems or you have extreme diabetic problems, maybe low muscle mass, sometimes you can restrict the caloric intake so much that it slows down a person's metabolism. Well, that's not good. There's other groups of people, such as those who are pregnant or lactating, that you do not want to shut down their metabolism or slow it down or mess with it, because you do not want to be detrimental to the baby, of course. And also then athletes, which kind of gets to the other point there that I talked about earlier. But if you are gaining in mass or wanting to build mass, you don't necessarily want to shut down all the calories that you're taking in. So you have to be a little cautious on those points there. That's why if you have any of these brittle diabetic or brittle kind of health concerns, low mass, also pregnant, lactating, all those issues, you should always talk with the provider before you consider doing any kind of fasting or a definite change in a dietary or lifestyle change like that. Okay, well, how about one more here? This is should be kind of interesting. So I noticed that I was kind of gaining a little bit of weight. And so I did some intermittent fasting. I've never been morbidly obese. I've always been physically active throughout my adult life. I exercise about 5 to 6 days, almost every day of the week in some capacity, not always, but around 5 to 6 days a week on average. Hello, family MC. And, that has done good things for my health. I've maintained decent health, but I noticed that my weight was coming up. So what did I do? I fasted. I did a pre-test. So I was at 197 pounds. And you can see that on that right-hand side, we did a Tanita scale. And this can measure, of course, your body mass index and your percent body fat. It can also measure your visceral fat rating. So your visceral fat is an interesting one. Fat content, abdominal fat, that's not good, right? But if you have abdominal fat, that's not nearly as concerning as visceral fat, the fat that is on your organs. So you can get a visceral fat rating from the bioimpedance scale that we use. So in this case here, I was at 197 pounds. It's the heaviest I've been in life. I've back around high school, early college, we're at 180 pounds. So what I do? Well, I took out lunch. I extended my fast. I'm still very active. I run, I exercise almost every day. And so that's the only thing I did is I just shut out my lunch meal and fast at that time. So I am extending my fast, and this time I'm just doing lunch. And here you can see the math on that. Come back. This is in April, the following year. The before is in July. And I don't know exactly when I started doing that. I think that it was probably about 6 months prior to this. But I went to 176 pounds, And you can see that my body mass index, of course, came down. It was previously at a 26.1 and it came down to a 23.3. The most interesting thing to look at, if you look at the percent body fat, I was originally at a 25% body fat and I came down to as low as 15.5. Some of the bioimpedance measurements can be off by 5%. Regardless, just from doing that one thing, from fasting during that time. So I usually have a shake for breakfast, have a green drink, and do those kind of things for breakfast. I then fast at lunch, and then I have a meal with my family in the evening. So all that being said, fasting can be great for about everyone. Let's see, I haven't done that test, but I know I have a fatty liver. Okay, Family MC. Well, that's one thing. You come back. We certainly can do the Tanita scale there, at least kind of get that rating. It's a great one. Good thing about visceral fat, by the way, visceral fat normally burns off more quickly than just abdominal fat. And visceral fat is more important to deal with than abdominal fat, because you can have somebody who is morbidly obese and they look like, they're unhealthy, but inside they're actually a lot healthier than they are on the outside. I mean, it's, understand. So the visceral fat is an important one to make sure you kind of get down. Okay, so to conclude, of course, not to test it to guess, but test is to know. And that's when we're doing when we're actually assessing people's health, we're not just guessing about it. We are making an active effort to find out where the insufficiencies are in in an individual's health, where perhaps that visceral fat rating is, where their thyroid or metabolism concerns are, what foods they should be eliminating, perhaps what they should be taking, right? Fasting. What can you find in your diet, your lifestyle today that you can fast and get rid of that one thing, that it's not good for you? And it's not a matter of you just eliminating everything from your diet. It gets very arduous and difficult, but almost all of us can find one thing, just one thing, and do that one thing and do it well. And if you're fasting the one bad thing, that can be miraculous long-term. Like just one soda a year can be as much as 7 pounds, right? Just from that. So, and past that, do you have perhaps some excess weight concern or blood sugar issues or hormone issues? Then perhaps intermittent fasting could be of value for you. Family MC, thanks for that comment there. I can attest, folks, these advanced blood work panels, eye-opening and worth every penny. Thank you so much for that. This is a good point to make. The lab testing and things you have out there, oftentimes they're finding crisis things, right? That's what a lot of medical testing is. What we want to truly do is true health care. We want to find things, not just find scary things, but find something you can do to get yourself healthier, to give your body what it needs and take away what it doesn't need. And sometimes those hidden causes of metabolism issues, they're hidden. You got to find them. And so that's what we want to do here. Okay, so anybody? Are you deficient? That's the kind of things we do there. We're a little past time, so I'm going to just go and skip through some of this, but that's what we do to find deficiencies. If you would like to, anybody who listens to our live streams here, if you would like to take part in a free hormone checklist evaluation where it's a questionnaire and I at least review, this is kind of like kicking the tires, so to speak. If you haven't spoken to us before and you just have concerns, you wonder, I wonder if he can kind of help me out. Just a talk, we most certainly would do that with you. We talk with patients from across the country, and we can help also facilitate and set up lab work in other areas where we're testing metabolism issues. We're testing estrogen, progesterone. We're getting those things accomplished. Coming in the office is always better for an exam, obviously, but if you'd like to take part in that free hormone checklist, please do that. Like and share this page, please. This live stream, our YouTube channel and our Facebook page. We send out information about our live streams all the time, and we are passionate about getting people to the root cause of the problem. So thank you so much for joining us, and thanks also Family MC for your comments and those commenting there. Have a blessed rest of your day. Murray Natural Integrated Health, setting the standard in natural health care. Take care.